The only thing that matters is if your hearing care professional follows best practices. It doesn't require that you have a doctorate in audiology to follow best practices. It doesn't require that you have to have a master's level in audiology to follow best practices. Literally everybody who touches a hearing aid as a professional should be following best practices. That is really the thing that determines whether or not, in my mind, you're good. There's animosity between both sides, and you typically have people be like, I know a lot of audiologists who aren't very good. And then audiologists are like, oh, well, I know a lot of hearing instrument specialists that aren't very good. At the end of the day, there's good and bad on both sides. There's audiologists who don't follow comprehensive best practices, or the place that they work for doesn't let them follow best practices. And then there's hearing instrument specialists that don't follow best practices when they're treating patients. And so it drives me crazy. I really don't care whether or not you have your audiology license or a hearing instrument specialist license. It doesn't matter as long as you're making sure that your treatment outcomes are fantastic.